الله الرحمن الرحيم. Principles of orthodontic appliances. Orthodontic appliances fall in two broad categories: passive appliance أو active appliance. Passive appliance which maintain the position of the teeth. These are commonly used for space maintenance after extractions or for the maintenance of tooth positions for the active tooth movement. زي ما احنا شايفين هنا عندنا early extractions of the teeth فعملنا band and loop space maintainer. وبرضه هنا البيشنس كان عنده missing of the upper anterior teeth فاضطرينا ان احنا نعمل له functional space maintainer for aesthetics and functional reasons. برضه ده نوع من انواع ال space maintainers, bonded space maintainers enhanced space maintainers. هنا برضو اللي هو maintenance of the tooth position for the active tooth movements ده بيعتبر زي الهاولي ريتينر اللي احنا بنعمله بعد علاج تقويم. Active appliance which bring about movement of the teeth. These are either incorporate active force within the appliance or transmit force from another source زي muscles of mastication أو circumoral muscles. الكلام ده هنشرحه في حينه. طيب ايه general requirements for the orthodontic appliances؟ لازم يبقى comfortable، لازم يبقى produce desired force for movement of the teeth، لازم يبقى fabricated from biocompatible materials عشان ما يأذيش patients، يبقى readily cleansables by the patients بحيث يبقى سهولة في التنظيف، وبرضه firmly positions in the mouth by the patients or by the doctors بيبقى سهل إن إحنا تعمل له insertion. The choice as to whether to use fixed or removable appliance بيعتمد must depend on the following requirements: the cooperation and intelligence of the patients and parents, the type of tooth movements required, the individual preferences of the operators, the amounts of adequate supervisions possible, أو general conditions of the mouth and teeth or hygiene بتاعه. طيب نتكلم هنا على type of orthodontic appliance. عندنا يا إما removable appliance أو fixed أو combination ما بين ال fixed وال removable أو ال orthopedic appliance. هنتكلم عن ال removable orthodontic appliance. The removable orthodontic appliance are so called because they are designed to be fitted and removed by the patients. من تسميته العيان هو اللي بيقدر يتحكم فيه، يشيل ويحط. طيب ال advantages of a removable appliance إن هو is removable by the patients، ده أهم ميزة، and can therefore be readily cleaned. The dentition and oral structure can also be maintained in clean and healthy state during appliance therapy. Type. It is difficult to apply severely excessive force to the teeth within the removable appliance, such force being dissipated by the dislodgements of the appliance. Construction of the removable appliance is mainly carried out in laboratory and relatively little chair time is involved. Main disadvantages of removable appliance are as follows. They can bring about only by limited type of tooth movements. The anchorage of the tooth movement is sometimes difficult since anchor's teeth cannot be prevented from tilting. Retention of the appliance is more difficult than with the fixed appliance. A high degree of cooperation and a certain amount of skill is required from the patient who has to remove, clean, and replace the appliances at frequent intervals. The uses of removable appliance بنحتاجه إذا كنا محتاجين limited tipping of tooth movements أو retention of teeth after orthodontic appliances أو for growth modifications. According to their use, the removable appliances are divided into mechanical appliance for tipping movements or passive appliance for retentions أو myofunctional appliance for growth modifications. Mechanical appliances, it consists mainly of three components, active components, ويبقى غالبا بيبقى الجهاز بيبقى فيه springs أو loops أو screws. retentive components وهو الكلاسبس اللي احنا بيقدر يعمل retention للابلاينس، والبيز اللي هو بيبقى متشكل من acrylic base plate for connections of the various components parts. active components أو active أو force component زي السبرينج زي ما احنا شايفين constructed from stainless steel wires، بيبقى غالبا بيبقى الدايمنشن بتاعته 0.5 inch. Most commonly used in the is the finger spring. How thicker than the wire, the greater the force produced. لو كل ما زودنا الثيكنس بتاعت الوايرز هتدينا فورس أكتر، فممكن تدينا حركة أكتر للسن. The longer the wire also, the less the force produced at the free end. So we add coil to increase the length. برضو ممكن بيبقى فيه active short labial appliance أو active labial bow appliances، برضو constructed from stainless steel، ممكن يبقى ال dimensions أعلى شوية 0.7. بيحتوي على 2 loop على أساس إن أنا بقدر أعمل activation لل 2 loop دول، فبيعملوا pressures على ال anterior teeth فبيقدروا يعملوا لي retractions، بس بشرط إن يبقى عندي spacing السنان تتحرك فيها. برضو ممكن نستخدم الإلاستيكس، بس it is less frequently used with the removable appliance. cooperation for the patient طبعا بنحتاجها كتير جدا في حالة استخدام الإلاستيكس دول، فما بنفضلهاش. برضو في السكرو زي احنا شايفين دي 3 سكرو. سكرو هنا ده بيشتغل في 3 dimensions، برضو هنا ده السكرو bilateral dimensions. Various types are used to provide intermittent forces in removable appliance. They are easier for the patients to manage than springs طبعا and are therefore useful for the less skillful patients. Adjusted by the patients or parents at intervals, in most cases once or twice a week, but sometimes more frequently. Has less tendency to dislodge the appliance than the spring. For retentions of the appliance بنستخدم أنواع الكلاسبس اللي احنا شايفينها دي. آدم كلاسبس اللي هو بيتعمل على البيرمننت مولرز أو البري مولرز. في بعض الأحيان بيبقى عندي ديسيدوس مولرز فبنعمل حاجة اسمها جاكسونز كلاسبس، أو برضو بنستخدم حاجة اسمها بول كلاسبس. زي ما قلنا البيس بليت اللي بيمسك الكومبوننتس بارت بتاعت الابلاينس الموفبل ابلاينس دي لازم بيبقى بايو كومباتبل ماتيريالز، بتبقى acrylic base plates. Support the wired components, contribute to anchorage by the engaging the teeth which will not move and prevent unwanted tooth movement. Should be relieved at the area of tooth movement and could be extended on the occlusive surface to act as a bite plane. يعني في بعض الأحيان بنحتاج إن إحنا نزود الأكريل على الأوكلوزال سيرفيسز بحيث إن إحنا نحط كبايت بليت. طيب ايه هو بقى الباسيف ابلاينس؟ الباسيف ابلاينس doesn't produce any tooth movements، ملش اي force. They hold the teeth in their correct positions for a period of time until remodeling of periodontal tissues and bone takes place. They are usually designed to hold the teeth from the labial side with a labial bow and from the palatal side with acrylic base plate. مثال لكده طبعا كلنا اشتغلنا في العملي الهاولي ريتينرز وقدرنا نعمله، وبرضه في الريتينرز اللي احنا شايفينه ده برضه اللي هو الشفاف ده اللي هو اللي بيطلق عليه بالاسكس ريتينرز. برضه في حاجه اسمها فيكسد ريتينر. فيكسد ريتينر ده بنستخدمه بحيث يبقى عباره عن braided stainless steel wires، بنعمل لها bonding على lingual surfaces of the anterior teeth. ممكن تبقى من الكناين للكناين، او ممكن ناخد معاها برضه لو احتاجنا البريمولر للبريمولر، والعيان ما بيحتاجش بعد كده ان هو يستخدم الريموفبل ريتينر. حالة من الحالات اللي هي عندها median diastema large median diastema، تمام، بعد العلاج قفلنا السبيسز وعملنا ريتنشنز للانتيريور سيجمنتس بفيكسد ريتينر. Myofunctional appliance. The force in this appliance is derived from the function of orofacial and masticatory muscles. Myofunctional appliance could be used for growth modification أو for tooth movements أو both. Type of myofunctional appliance ممكن بيبقى عندي activators، oral screen، deep bumper، lower inclined plane أو bite plane. الاكتيفيتور زي اندرسون أو monoblock appliance أو فرانكل appliance أو twin block appliances زي ما احنا شايفين. It is used for gross modification in cases of developing class 2 division 1 malocclusion. A theory of its action is that by constantly positioning of the mandible in a more forward position, it will allow all remaining growth to be expressed forward. هنا monoblock activator consists of one block of the acrylic fit the upper and arch as well as the lower arch when protruded forward. The condyle being held in an anterior position in the fossa will include growth at the condyle and remodeling at the fossa. A lower arch being protruded will be under constant pull of the masticatory muscles, which try to resume their normal rest positions. The backward pull of the muscles will be transmitted through the appliance to the maxilla and maxillary teeth and tend to move them back. زي ما احنا شايفين الحالة دي كان عنده كلاس 2 مال أخدنا الإمبريشن للعيان وخليناه، أخدنا البايت بتاعته وكان العضة بتاعته لازم يحط الماندبل in a more forward positions، وبعد كده بنعمل constructions للمونوبلوك أو الأكتيفيتور أبلاينس بحيث إن احنا العيان بعد ما بيستعمل الجهاز تمام بيتصلح ويبقى زي ما احنا شايفينه في آخر صورة دي. ده برضو نوع من المايوفانكشنال أبلاينس اللي هو بتقول عليه فرانكل أبلاينس. برضو في من أحد الأجهزة اللي هي بتستخدم ك myofunctional appliance اللي هي oral screen. It could be used for correction of proclined upper incisors by using the tensions of the orbicularis oris muscles, lip and cheek, provided that the anterior teeth are proclined and spaced. بحيث ان من خلال المسلز بتاع الاوربيكولاريس اورس مسلز والبريشرز بتاعتها transmit الفورسز من خلال الأورال سكرين على البروكلايند anterior teeth بحيث إن هي ترجعها في مكانها. ممكن الأورال سكرين ده يبقى باسيف في حالات إذا كنا هنستخدمه ك habit breaking appliance في الناس اللي هم عندهم mouth breathing، بس لازم to be sure إن هو they have a good nasal breathing. برضو من الفانكشن appliance أو my function appliance اللي هو lip pamper. It uses the muscles tensions of the lower lip to exert distal force on the lower molars. Meanwhile, it eliminates the lip pressure from the lower incisors teeth. Thus, it allows the tongue to procline the lower incisors teeth. برضو من الأجهزة اللي هي ليها myofunctional effect اللي هي bite plane. Acrylic bite lock converting the occlusal surface of the upper or lower posterior teeth and used to prevent their eruptions. The flat plane built palatal to the upper incisors and occluding with the lower incisors, and the canine could be used to prevent their eruption and free the posterior occlusion to allow their eruption, thus correcting the deepening of the bite. On the other side, if we use the posterior bite plane, it could be used to make intrusion for the posterior teeth and closing the anterior opening of the bite. Fixed orthodontic appliance. Advantages of fixed appliances used for retention presents no problem since the appliance is cemented or bonded to the teeth. Less skill is required from the patients in management of the appliance. It is possible to bring about tooth movement with fixed appliances which are not possible with removable appliance, like torque or bodily movement. Many teeth could be moved at the same time. Disadvantages of fixed appliances. The appliances fixed to the teeth are more difficult to clean than the removable appliance, and it is more difficult to maintain oral healthing during appliance treatment. The possibility of producing adverse tooth movements. Fixed appliances are securely attached to the teeth and could only be altered or removed by the orthodontist. It consists of attachments, arch wires, and auxiliaries. Attachments, the brackets with tubes with auxiliaries. 3 different types of brackets: stainless steel or ceramic brackets. Which is an auxiliaries. 19-hole closed coil spring, أو 19-hole coil spring, uprighting coil spring, أو uprighting spring. There are 2 ways to fix the attachment on the surface. The brackets or tubes are welded to the stainless steel band that fit around the tooth and it is cemented to it. This is old techniques, or by using an acid etch and composites. The tooth surface is etched and the base of the brackets or tubes has meshwork for the mechanical retention through debonding. Arch wire. The arch wire used with fixed appliances could be divided according to the cross sections into round, a multi-strand, or braided, أو rectangular or أو نقدر نتكلم على two types of أو two types of materials most commonly used in orthodontic treatments: stainless steel alloy أو nickel titanium alloy. Type of fixed appliances: في اللي هو الستاندرد edgewise technique اللي هو appliance where the bracket slots and tubes are rectangular and receive a rectangular arch wire, or a straight wire appliance is basically an edgewise appliance with torque and tip built in the brackets. Where there is all techniques also named baked appliances, which use only round wires and many accessories to produce torque and tipping of the teeth. It has edgewise brackets, straight wire appliance brackets with torque and angulation built in within the brackets. And this is also type of brackets named frictionless brackets to reduce the frictions between the wires and the brackets and speed the movements of the tooth. What is the difference between the fixed and removable appliance? Comparisons between both. Fixed appliance make a precise control over the force distributions to the individual teeth, mean that rotation and controlled root movements are possible. In removable appliance, single points applications of, uh, of forces mean that only tipping movements are readily produced. For fixed, multiple tooth movements can be performed simultaneously. Removable, usually only a few teeth should be moved or anyone on any one time. Complex to make and use, so special training is needed in the fixed appliances. For removable, comparatively simple and should be within the scope of the dental practitioner for carefully selected cases. The chair side time is comparatively long for the fixed appliances. Chair side time is short, but laboratory time greater than for fixed appliance. Components are costly in the fixed braces for fixed braces. Components are cheap for removable braces. Oral hygiene is made more difficult for the fixed appliances. On the other side, as in removable, as the appliance is removable, the problems of oral hygiene should not be increased. Fixed removable appliances combinations sometimes of value to combine the properties of fixed and removable appliances to achieve the advantages of both. Such combinations between the appliances are used for localized tooth movements of uh, a type which couldn't be achieved with removable appliance alone. Add this in picture as these pictures, rotated lateral tooth. We could correct these tooth only with simple appliances with wires attached to the fixed appliance on the molars, between the molars, and could correct the rotations of the teeth, of the tooth. Orthopedic. The appliances are used to modify jaw. Growth can be broadly divided into headgear أو chin cup أو functionals. الهيدجير في cervical, occipital and high pull headgear أو reverse headgear والchin cup في occipital or vertical والfunctional appliances عليه قبل كده. الهيدجير is used in orthodontics to modify growth of the maxilla or to disguise and protect maxillary teeth or to reinforce the anchorage. When headgear is used for skeletal modification, we need heavier forces. Such heavier forces bring about the actions on the sutures of the maxilla, changing the magnitudes and directions of their growth. Some combination of skeletal and dental changes occur, and in most instances, tooth movement changes exceed skeletal changes. Headgear should usually be worn for at least 8 to 14 hours per day to achieve successful results. For orthopedic changes, forces used are in the range of 250 to 500 grams per side. For dental movements, they are in the range of 100 to 200 grams per side. There are several types of headgear that can be used to bring about desired effects. Type of headgear and desired forces level should be selected according to the specific treatment objectives for the patients. Type of headgear: cervical headgear, occipital headgear, or reverse headgear. Cervical headgear: more commonly cervical headgear used for correction of class 2 malocclusion, division 1. As we see in this picture, the right. Occipital and high pull headgear. Occipital headgear is commonly used also in class 2 correction, in which you're controlling anterior open bite tendencies in part of their problem. Protraction headgear, reverse headgear. Protraction headgear is used for skeletal and dental protractions of the maxilla in class 3 malocclusions caused by maxillary deficiency. Protraction headgear exerts the mesial force on the maxilla below the center of the resistance, with an equal and opposite reciprocal forces on the chin and forehead. Chin cup. Skeletal class 3 occlusions with a relatively normal maxilla and a moderately protrusive mandible can be treated with the use of chin cup. The objective of early treatments with the use of a chin cup is to provide growth inhibitors or redirections and posterior positioning of the mandible. The orthopedic effects of a chin cup on the mandible includes redirection of the mandibular growth vertically, backward repositioning, rotation of the mandible, or remodeling of the mandible with the closure of the gonial angle. Early correction of an anterior crossbite with chin cup appliance prevent retardation of the anteroposterior maxillary growth. Chin cup are divided into two types: occipital pull chin cup with mandibular protractions, vertical pull chin cup that is used in patients presenting with a steep mandibular plane angle and excessive anterior facial height. Two types of occipital pull chin cup and vertical or high pull chin cup. Most of the reported studies recommend an orthopedic forces of 300 to 500 grams per size. Patients are instructed to wear the appliances 14 hours per day. Orthopedic force is usually directed either through the condyle or below the condyle. Patients with mandibular excess can usually be recognized in the primary dentition spats defect that the mandible appears retrognathic in the early years for most children. Treatments to reduce the mandibular protrusions is more successful when it is started in the primary or early mixed dentitions. The treatment times varies from 1 to 4 years depending on the severity of original. Thank you for all and good luck inshallah.